Thank you very much, and thanks for the invitation to moderate this session, which is meant to be a transition. We've heard about progress from various perspectives. We're going to start to transition to the next day and a half of the meeting by talking about goal setting and buy-in, and you're going to hear about those topics from a wide perspective as well. I was reflecting on the history that was described earlier about this series of meetings, and the first meeting was held before the FDA had formally issued its guidance documents, the regulation for VFD, as well as before the PACCARB was established, which is the national enterprise focused on antimicrobial resistance. And then very recently, the World Health Organization has sponsored the Global Action Plan. So a lot has occurred since this group first met. So what this panel, I hope, will do, and will be interested in your feedback, is to tell us what more needs to be done from their perspectives, what has been done, what's been successful, what goals are important and are measurable. I think we've all been involved in planning groups, strategic plans or otherwise, where it's easy to lay out plans that can be very specific. The hard part is to develop measurable goals for the various aspects of those plans, so hopefully we'll touch on that as well. I think we could all agree that just simply the number of pounds of antibiotics sold in animal agriculture versus in human medicine is not extremely helpful, so we need to move from that. And then, you know, what evidence of success has there been so far? And what more do we need to know? That will be addressed in the next day and a half, but they may touch on this as well. And finally, in terms of buy-in, is everybody bought in? Who needs to be? We want to make sure that we continue to kind of move in the same direction. So I think all of these things will be touched on by this panel here. Let me introduce the panel, and I'll point out that in the program only one of the three speakers is listed there, so I will take the time to introduce the two who are not in the program. So first we'll hear from Dr. Rosie Busch, who's a graduate of UC Davis School of Veterinary Medicine. She's practiced in a mixed animal practice in a rural setting, and then she returned to UC Davis to get an internal medicine residency in large animals. She stayed on as a clinician and faculty member there as well. And she recently has joined the California Department of Food and Agriculture as the veterinarian specialist of a new program called Antimicrobial Use and Stewardship. So we'll hear from her first, and I'll turn it over to Dr. Busch.
Thank you for having me. I want to touch on a couple of talking points that Dr. Jones wanted to cover. I recently joined the CDFA on this effort, and so I wasn't a part of the process of the bill becoming law, but I think some of those points are important as we talk about goal setting. So I think you're probably all very familiar with the Senate Bill 27 in California. It was sort of a reaction to an assembly bill that was being produced around the same time that did not have a lot of input from multiple stakeholders. So the Senate bill was something that they really had to build a strong representative group when designing that bill and try to be ahead of the issues instead of reactionary. And really at the starting point they needed to identify a trust broker during the legal process. That was Senator Hill. And not just the senator, but also the senator's staff and how able they were to understand the complexity of this issue. And Senator Hill's staff did a really good job of meeting with all of the stakeholders individually and checked in with everyone, and then also did their own research, and then, you know, kind of brought that research back. Okay, well, what do you think about this? Is this true? So they did a really good job of facilitating the collaboration between the multiple stakeholders. And then from the legal process ongoing, it was decided that that would be a good role, the trust broker role would be a good role for the State Department of Ag, or the state veterinarian. So it was also really important, though, to maintain that really close collaboration with the Department of Public Health, and make sure that we were all on the same page. And it makes it a bit easier when talking with the governor's office, consumer advocates, and physicians on the issue if we're all on the same page. And I think we can all agree that no one wants legislators practicing medicine via legislation, whether you're a physician or a veterinarian. And then on identifying a goal, the key was to identify a common goal and describe it in terms that all stakeholders understand. So the common goal was optimizing animal and human health, while reducing the pressure for antimicrobial resistance. And I think that's something that we all understand. And then the tool that we use to kind of achieve that goal or try to make progress towards that goal is the strategic plan. And I know that they use that in Minnesota as well. So it's basically a work plan that allows us to maintain focus and identify on our identified goals, and it basically helps us kind of keep people who want to shift our focus kind of on the sidelines, so that we can maintain our focus and not really buy into their maybe alternative agendas. So we also have multiple advisory groups, and they're with universities, kind of specialized people within the field of antimicrobial resistance, livestock production, public health. We also, on the surveillance side, data gathering, we're working with multiple agencies. So we kind of have our checks and balances, and then our job is to listen to our advisors and respond to them. So as we move forward, we don't want to be developing policies or regulations in a vacuum. So we're very open to any feedback that comes our way. And as you can imagine, cooperation is really important. So we're working with diametrically opposed constituents who don't understand each other, and that relationship is very fragile. So it takes stamina to continue on this path, and especially with some stakeholders who are pushing their agendas on multiple platforms. They're not only working through us, they have other ways to try and get their agendas through. So it's really important to realize that we're building a cathedral, and we're just right now at the ground floor, and they may be trying to throw stones through our windows, but we're making progress, so that's all right. So I have an example for you of something that we've dealt with recently. We're trying to provide materials that are useful for producers and veterinarians to understand what the law means, because as you guys are probably well aware, legalese is not everyone's language. So just trying to clarify what the use limitations are in California. So California took the federal mandate and expanded upon that, and there is an extra limitation on preventative use, and it says that preventative use is allowable with a justification by a licensed veterinarian, and then in another statement it says that unless it pertains to Section A, which is treatment, control, or use for surgical or medical procedures, medically important antimicrobials cannot be used in a regular pattern. So I hope I confused you, because it is confusing. And our goal was to clarify this for producers and veterinarians so that they can comply with the law. So we put a statement out that was approved by the Veterinary Medical Board, because it is not our job to make policies for veterinarians. and how they practice. And it's part of the statement said, a MEAD can be used to prevent disease in livestock if under the professional and clinical judgment of a veterinarian, there's an increased risk of developing an infection as long as the MEAD is not given in a regular pattern. A regular pattern is never defined in the law. A few examples of regular pattern use may include giving MEADs solely based on the animal's age or weight, the calendar date, or a life stage event of the animal without further justification for treatment by a licensed veterinarian within a valid VCPR. So I don't know if you've all seen the article that was put out recently about how that was identified as a loophole for veterinarians to be able to use MEADs prophylactically. And so we changed the statement so that it reflected the language of the law, which is still very confusing. And then recently we got a letter back saying that we need to explain what that means. And their language was, when young animals are weaned absent signs of bacterial disease. So we're saying the same thing, that if a drug needs to be used preventatively, it should be, if it's to treat an animal. But it's being viewed through different lenses. So I think this is kind of what we're talking about, how we are going through, we have the same goal, but our work is heavily scrutinized, as it should be. But we just have to realize that we're going to be viewed, the work that we do is viewed through a very different lens of what maybe a producer is seeing, or a veterinarian, or the consumer advocates. So I think it really is just opening up that discussion as far as what our goal is and what we are really saying here. And then as far as buy-in goes, again, just maintaining that goal as our direction and maintaining those relationships. I think everyone on our program are very approachable and happy to have these conversations. And our goal is to serve California's animal populations, veterinarians, public health, consumers. And then, we have a mandate to collect data, and we're mandated to collect data, and the producers they can voluntarily give that data. So how do we show that that's a successful system? And so that's where we're definitely trying to achieve some buy-in. And I think it is working well, because we have been working with industry representatives from the very beginning. So I think it helps in the conversation that, we are working with your industry representatives to, try to achieve data that is representative of California animal populations. So, and then that data should feed into our stewardship program, so that our stewardship efforts are very individual to California animal populations. So that's where we're at right now, and it's definitely challenging, but very exciting. So I look forward to your questions and feedback. Thank you.
Thank you, Dr. Busch. Next up will be Dr. Angie Siemens. Her bio is in your program, but I'll just highlight a few things here. She's presently the Vice President of Food Safety for Cargill, and is responsible for all of the food safety and quality management issues at Cargill, and in particular focused on beef and turkey production. She has previously worked at Smithfield and Kraft Foods and a couple of others. She received her education from the University of Missouri in meat science with both a master's and a PhD. And we welcome Dr. Siemens.
Thank you, and thank you to the NIAA Planning Committee for the invitation to speak. This is an interesting topic, and I think I changed my presentation 3 or 4 times in trying to approach this. So what I did is I backed up and took a look at Cargill and some of the goals that we have attempted to navigate through this system, and then what has been those results and those learning from that. Those of you that don't know Cargill, one of the largest meat and poultry processors, producers in the country. And so we have a large reach, you know, from coast to coast on a lot of things. But we also serve, I kind of describe it as a hourglass, where you start at the top of the hourglass with all the producers, all the suppliers, everything that comes in. And then as you go to the middle, you kind of end up there in the middle where we transfer and convert, you know, that animal to muscle. And then you drop it out to all of these consumers and customers, you know, there at the end. And everyone's got an opinion on both sides of this. And we play in that middle space in trying to bridge that gap between those two spaces. So this will be a little approach in looking at that where we're playing in the center and trying to work on both sides of it. So what are the couple things that we've looked at in terms of some goals? I had some really cool pictures in here that didn't come through, so you'll have to use your imagination. There was a turkey there. Reduce antibiotic use in turkeys. And I'm going to do this a little bit on the why, where, who, how, and when. Go through a couple of examples, then I want to come back to really what we learned at the end, right? Why do we want to reduce it? We want to slow the development of antibiotic resistance. That'll be common, you know, all the way through here. And I want to come back to that when we get to the measurements section on, is the goal and the why the same? Do we talk about that, you know, succinctly enough? In our case, we're looking at growing, you know, how can we do that at our turkey growing operations? In our case, we have over 700 family farms growing our turkeys for our two brands that we sell, the Honeysuckle White and the Shady Brook Farms brands. How did we do that? Right? We started with eliminating the use of antibiotics labeled and used for growth promotion, and we did that a year before the guidance came into effect, so went ahead and implemented that. First major turkey brand to implement it. You can imagine some of the discussions that were going on between our veterinarian there that oversees the operations, our commercial folks, and you heard the conversation this morning about how does marketing get involved with the decisions that are made at the farm level. And I can tell you, when you're trying to meet the consumer need, they do. There are conversations about goals and what we do in the mix of this. So in this one, it was coming anyway. This was an easier conversation to have in saying, hey, we're close. Let's go ahead and initiate this one. So that one wasn't as painful as a couple more that we're going to get into. The second goal, reduce antibiotic use and offer choice for consumers. Again, you start into that conversation of how do I take the top part of the hourglass and meet some of the needs and the purchasing power of those at the bottom part of the hourglass. Again, the why, very similar, slow the development of the antibiotic resistance. Again, turkey growing operations. In this case, we had a select group of family farms growing turkeys for what we have branded as our Honest Turkey brand. And in that particular case, what we're doing is we are eliminating the use of antibiotics in turkeys so that it's a raised without antibiotics claim in that. But you can see that there's an and in here. And in this particular case, it's and meet the antibiotic stewardship plan. And we'll talk a little bit more, I think, over the next day and a half about what is it to be antibiotic stewardship plan. But we also have to meet food safety requirements. We also have to meet animal welfare requirements in going through here. And it isn't just acceptable to remove the antibiotics and not have a total plan about how you're going to monitor the health of the birds, of the flock, how you look at the welfare. And then particularly for us with salmonella coming in with poultry population, what's the impact on our producing facilities or our production facilities in the salmonella control that we have? So we've had to take a look at particularly who we've put onto this program. What are those other characteristics beyond being capable of removing the antibiotics? With that, we've been successful. We've got the product started in 2016, or started in 2016, and then is available this year for turkey season, which is coming up. Go buy your turkey for Thanksgiving, okay? So shameless plug there. The other part about it is, though, because it is a section of what we do, we've not gone all in. You know, in this case, it is not for every growing region that we have. It's not for every producer to be able to move into this space. But we also have the ability to not force these individuals to make a decision on the last week before they go to slaughter as to if you break with a bacterial infection, do you treat or not? Because we do have venues to bring them in on schedule and just move them into the programs that allow the antibiotic use. And I do think that there is a discussion that we need to continue to have, particularly in that last 10 days, week, et cetera, in some of these programs. Is there an option? Can you really treat as you should on some of that? So that has been a greater conversation that we have had, but we've been able to be successful, and it's been kind of a migration, you know, as you're going through. Let me switch species here because it's a more interesting conversation when we get over onto the beef side. In this particular case, we have in turkeys and most poultry, not all poultry, but most poultry, you have a touch. A more direct touch between us as a processor to our growers. The contracts, numerous ways, a supply chain that is pretty defined. Get over on the beef side and we're going to struggle a little bit. We don't have that touch. We do not, Cargill, one of the changes that occurred this past year is we sold all of our cattle feeding feedlots on there. So we no longer have those, but it was a very small percentage of what we had, but we've even sold the ones that we've had. So we don't own any feedlots. We have relationships with the feedlots, some of them tighter than others, but we do an awful lot of cattle off of the open market 10, 14 days in advance. We'll go in and purchase those cattle to come in. So you do not have that degree of oversight and the ability to make changes in the marketplace the same way you do in the poultry space. One that we did here on this particular one, and we talked about it a year ago, was to, again, reduce shared class antibiotic use in beef cattle feedlots was our goal. Again, the why was slow the development of antibiotic resistance. In this particular case, we had 8 beef cattle feedlots. At that time was our own facilities with some strategic partners, and in fact those strategic partners actually purchased those feedlots, and they have continued to remove 20% of the shared class antibiotics used during the feeding period of about 1.2 million head capacity facilities. So that has been ongoing over there, and we're continuing on that and continuing to monitor. And in fact, our strategic partner has some of our supply chains that they've removed the shared class completely, that they're no longer even feeding it. As we're learning more about the outcomes of being able to remove that product or those products from our supply strain. So we're continuing to look at that and what does the expansion of that look like. What else are we doing in this space? Because that's just 1.2 million head out of lots and lots of millions that you go forward. One tack that we have taken is, can we increase the implementation of the beef antibiotic stewardship programs through, in this case, BQA? And the target here was, again, to slow the development of antibiotic resistance is the why. How? Increase the awareness of judicious use of antibiotics within a management system. And why do I state this how? I struggle just a little bit with who is accountable at the feedlot level of assuring that they have a antibiotic stewardship program, a working plan. Okay? I absolutely understand the veterinarian's role in that. But from our standpoint, and I really do think in talking to our consumers and customers, that they're not going to hold the veterinarian accountable. It is the producer who is accountable. And that producer, that feedlot operator, that grower has to have a management plan in their system. It has to be working and have all of the inputs, you know, the oversight with the veterinarian, but it is their plan. And so we have to assure that our producers understand these programs, that they own that plan, right, with all the inputs that they need and going through. So BQA is one of them in terms of that education relative to those producers, because they end up being certified, not the veterinarian, right? They are certified on the training, and it will evolve and move forward as we go. We focused first on our U.S. Feedlot production. 90% of our fed beef cattle suppliers were past that already. That last little 10% is a lot of little guys, and we're still struggling on narrowing that window as we go through. We've also trying to get into other supply chains. Canada don't have a BQA like quite yet. Other cattle supply chains farm in the cow piece, so continuing to move that in the various sectors. This one Joe already mentioned a little bit earlier today, and he's going to talk about it again, so I won't spend a lot of time on this. We have multiple species, and when I look at the turkeys, I look at the chicken, I look at the beef, I look at swine, all of them have something close, right? I mean, everybody's got their definition as we're moving forward. As we are working with our customers, they really don't care that swine is different than beef. What they want to know is, does the animal protein that's being sold to them, are they covered under antibiotic stewardship program? And if it's easier to bring one kind of audit, one kind of question back, they'd rather have that than have me explain 4 different programs to them. That's more complexity than they want to deal with. And so what Joe mentioned in bringing the producer trade groups together, you know, can we get the basic principles of a PQA antibiotic stewardship in the pork space in the same direction or under the same principles as beef, as dairy, as chicken, right? So that when you go in and ask, you can ask the same 6-level questions and their program's answers will be yes, right? And it makes it easier for us to transfer that information from production side to our customers on there. So I'm really tickled that this process is moving forward. Can we do like principles and then allow the species to do their differentiation under those principles? And I really think it's possible, currently in discussion. So what have we learned? Oh, there were some cute chicks there, right? All right, this is complex, right? I mean, just everything you've heard as we've tried to deal with trying to figure out how to take the protein supply chain and then move it into our customers, it is complex. We still have several things, and hopefully we'll talk a little bit about whys and goals, right? More of our issue has been around why me, right? We've talked a little bit about societal versus the individual, talking about human health versus animal health. Why me, the chicken grower, have to eliminate my use of antibiotics, right? And I don't know that we've really got that down to that granular level in that real explanation very well of why me, why the individual has to make that behavioral change, right, you know, in the mix. Really, in everything that we've seen, you cannot address antibiotic use outside a stewardship program. There are too many unintended consequences we need to gather in with that, so we have to tie that together. We need to determine what the measurement or currency is to show success. I call it currency. In food safety space, which I come out of, it's my HACCP program, right? It's not my deficiencies to my HACCP program, it's actually my HACCP program. Do I have a system in place to assure that I don't produce unsafe food? I really do think, you know, is the question of, you know, do I have to do X milligrams reduction over time, or is it that I can have a stewardship program, and that stewardship program that gets implemented, gets audited, gets verified, et cetera, is that the currency? Can we work on that type of currency moving forward? I think it's still to determine. Progress is slower, particularly buy-in, when you move from direct control to indirect control. Right? You're talking particularly you can move in poultry to beef. The other part of it is as you involve more supply chains, you've got those differences you have to weave in, and what's the commonality that you can drive that buy-in moving forward. I would state we've got numerous questions as an organization on, okay, I see all this stuff going on in poultry, why isn't anything going on in beef? I would really plead that people continue with the message that lack of visibility does not mean lack of activity and lack of progress. It's just that we're horrible at telling our story, right? Animal agriculture has never been really good at telling our story, and we've got to figure out not only how to do it internally, but also externally quite a bit better, because I do think there is an awful lot going on that doesn't get put out like a company with a brand name that makes a declaration. That gets some big headlines, but a lot of stuff where you can't tag it to that brand name doesn't get that kind of visibility, and we need to figure those parts out. So that's an odd and in group of things, but really want to thank you and look forward to your questions.
Thank you, Angie. Next, we're going to hear from Ron Phillips. Again, his bio's not in the program, so I'll just let you know. For those who don't know, Ron, he's the Vice President for Government and Public Affairs for the Animal Health Institute, has been involved in this issue for quite some time. He is responsible for overseeing that association's lobbying efforts on Capitol Hill, as well as many outreach efforts. Previously, he worked for the Fertilizer Institute and the U.S. Feed Grains Council, as well as in the U.S. Senate. He has degrees in communications and journalism and has worked for newspapers in Ohio and Virginia, and certainly published in the trade press as well. So thank you, Ron.
Thank you. I recognize that I'm in the precarious position of being last on a long and interesting afternoon, and I think we also need to recognize that the reason that the program is not up to date is because I was perhaps not the first choice for this slot. But that's okay. That's okay. I want to encourage you by this fact. I am a Buckeye. And the Buckeyes have proven the value of the third stringer in the last few years, so take heart. I guess to kind of set the context here, we've been talking a lot this afternoon about progress and successes and where we've come from, and now kind of turn toward what else needs to be done in terms of additional goals and buy-in. And my perspective is the policy perspective. So let me just briefly maybe start by recounting some of the progress that's been made in the policy arena, because I think it's fair to say in that arena we have seen a turn in the last 3 or 4 years away from accusations and finger pointing to the kind of terminology we've heard a lot of this afternoon, which is collaboration and cooperation. So let me just briefly recount where we've been on that score in the policy arena. And to start with, I guess I would maybe surprisingly give a great deal of credit to the previous administration, because I think in terms of policy, this started back when the President put together the Advisory Council report, the PCAST report. The President's Council of Advisors on Science and Technology did a report on this very issue, and did do a lot to encourage input from a broad group of stakeholders, including the agricultural community, which resulted in a report that was fairly balanced and led to a White House summit on this topic that brought together a broader range of stakeholders. And I think you will hear, as you've heard already this afternoon, accounts of the magic of bringing together veterinarians and human health professionals to talk to one another, and the White House summit was an example of that. That then, of course, led to the creation of the PACCARB, and again, I think one of the things we have seen as the PACCARB has gone about its work is people from disparate backgrounds coming together, and there are members of that group here in the audience. I hope you will back me up on this, but members of disparate backgrounds coming together and sharing information and learning from one another and making some progress. So I think a lot of the credit belongs there in terms of changing the tone and tenor in the public policy arena. A part of that effort as well, I would cite the effort that has gone on in the last 3 years, where public health and agricultural stakeholders have come together in support of appropriations for data collection. The FY17 appropriations budget contains $7 million for USDA to collect data. Everybody, we've heard about the need for more data. I'll talk more in a minute about data, but there is broad, diverse stakeholder agreement that that needs to be done, and there's been collaboration in terms of making that happen. A number of both questioners and presenters this afternoon have talked about NARMS. The NARMS meeting last week I thought was very instructive. Some major top-level learnings, I think, from that meeting. Fewer pathogens are being recovered, particularly from the retail meat samples. Resistance in humans for salmonella continues has decreased over the life of the program. There's some good news there. Pat McDermott made a very interesting presentation at the end. I hope he shares some of that data when he speaks tomorrow, comparing resistance rates, human resistance rates across the world, both between Europe and the U.S. and other countries. It was very encouraging. I'm tempted to make the observation that maybe this is one area where we truly are making America great again, but that might be controversial. We've heard a lot about it this afternoon. I won't spend too much time on it, but let's again stop to recognize the implementation of 209-213 to the FDA program. FDA articulated a goal of judicious use. They invited industry and other stakeholders to sit down and work cooperatively toward that goal. There were a lot of naysayers well up until probably January 1st of this year who said that it will never work. Industry will never volunteer to give up claims, but it has worked. It's worked largely because of the strategy that FDA took to do it through a voluntary stakeholder approach. As Dr. Flynn pointed out, it was voluntary at the beginning. Implementation is not voluntary. Once those claims have been removed, stakeholders do have to comply. And I think as a matter of fairness, that's a good model for looking at how things can get done. I'd also mention our sister association at the global level called Health for Animals has recently approved an antibiotic commitment based on 5 principles. Those principles are protecting animal health and welfare and a unified One Health approach, using antibiotics judiciously and responsibly, investing in development of products for both prevention and treatment, promoting disease prevention and increased access to products and expertise, and increasing knowledge, transparency, and communications. That can be found on their website. I think this is in line with a lot of the other efforts that you've heard from AVMA and others this afternoon about better defining judicious use and responsible use. Finally, on data collection, there are voluntary efforts going on there. Part of this program that USDA has in terms of collecting data is being supported by voluntary inputs from the species groups. Swine, cattle, and poultry are all collecting voluntarily data that will feed into this program. Again, another example of public-private collaboration in terms of moving towards these goals. So I hope that there are some common themes that maybe occur to you from sort of these successes that I have listed that give us some instruction and lessons for some additional goal setting and buy-in, one of which obviously is the voluntary, cooperative, stakeholder-driven approach works. It has worked, and it's working, and it works better and faster than a regulatory-driven approach, or even specifically a legislative-driven approach. I would cite the continuing confusion that persists in both California and Maryland over words that we all had to agree to that people are still seeking to define. So they're still struggling with that. And you have my sympathies for that, and I've got some advice for you as well. Set agreed upon goals. So you know, I think everybody in this room at least recognizes, and it was stated plainly by Dr. Flynn earlier, that reduced use was not the goal of the 209-213 process, nor should it be the goal of other efforts. The types of use and how it's used is more important to health outcomes. Back to Dr. Siemens' point that this is complex, and it's not simply let's reduce use and fix all of our problems. Keep a broad perspective. Don't lose sight of the forest for the trees. Focus on reduced use leads to unintended consequences for both animal health and welfare. So there are other aspects of this program that we need to learn more about as we move into this process of a new atmosphere in terms of 209-213, no growth, veterinary oversight. What does that mean, and what are the unintended consequences? And let's be sure we understand those as we move forward to the broad goals of addressing these human health concerns. Data collection. Data collection is becoming, we all recognize how important it is, and yet it's becoming very fragmented and piecemeal. In addition to the USDA effort, we have the sales data and what's going on with that at FDA. We have state programs now, both in California and Maryland, that are going to give us lots of different information that people can pick and choose from. And one of the issues there is that we have never collectively sat down and defined what the goals of our data collection are. And so what we are doing is piecemeal grabbing what's easy to grab and hoping that it's going to inform us somehow. And we need to be more thoughtful about data collection. Stakeholders need to come together and focus on collecting good use data that will inform both policy decisions and management decisions. And finally, let me just say something about, and I said something about this earlier, what I might call cross-cultural communication. We've heard examples of it this afternoon. We were involved in some of these kinds of meetings a couple years ago ourselves, but there is real power and magic and education that takes place when you get a group of veterinary professionals in a room with a group of human health professionals and let them start talking about what they do and why they do it. And we've started doing that over the last 3 years, and we need to do more because that's where real progress comes in. And I will close there and entertain questions. Thank you.
All right. Thank you very much to our panelists. We have about 15 minutes or so on the agenda for your questions. I have a few, but I want to open it up because we're interested in your perspective.
So thanks panel. And I have a question for Angie about Cargill. So you brought a different, trying to be diplomatic here, but a different point of view from Sanderson Farms. So in these pressures that you see from the consumer with no antibiotics or decreased use of antibiotics, the innovative practices that you're putting in place to meet these consumer demands. Do you see some of this innovation being successful in not negatively impacting the welfare of the animal, and maybe some of these innovations could move forward to change the way we, do production agriculture in the future?
Okay, let me back up with your first statement just a little bit. Sanderson's just a little more vocal, about their practices because they believe that not everyone should jump onto a marketing bandwagon, and I agree with them. Now, what we have done and what Cargill does is saying we're going to offer choice where we can make that viable, right? Because we depend on our growers depend on us to both stay in business, right, in some cases. And we are going to not sacrifice the health and food safety welfare of our animals. Right? And so we have been able to do that in some certain streams, i.e. within a certain geography and a certain grouping of turkeys. But I'm not convinced we can do that across all of our turkeys today. In where they're growing, Tom's compared to, you know, growing turkey toms, I've got 22 weeks as opposed to 7 weeks on chickens, and I can't speak to the chickens, but a lifespan differential, ability to have additional bacterial infection over that time period creates some additional issues for us. And you get into southern Missouri, and there's all kinds of things that pop up just in that geography and the humidity and the environment with that. So we have been able to look at some certain streams, certain producers that have some differences relative to how they're producing and make that work. Again, it's going to take a little more time, and I don't know in many cases if our other producers are doing that many things different. It's just some different environmental concerns or practices that end up tying into it. Now, have we done anything special on our raised without antibiotics? We're looking at some additives and trying to figure out if there's pre, I mean, you do the list, right, of those things, which none of them are as consistent and as useful as what our antibiotic programs were. So we are constantly struggling on trying to figure out what are those 5 or 6 things, you know, that equates, and I can get the same productivity, I can keep the same animal welfare, I can keep the same health and keep my salmonella down, which gets complex very, very quickly, right, in trying to meet all of those. And guess what? What works this season on my next turn probably is not working. What we are seeing is, as we try and find them, the bugs are adjusting or the environmental conditions are adjusting, and we're having to constantly adjust. So the answer is we need some more innovations. I do believe some of them are transferable, not always transferable, nor are they always repeatable as we're moving forward. So this is a long road, and it will be very geography specific, species specific as we get into this, and what it is that meets all of the objectives that we want to meet at the same time with the overall why, right, in keeping these antibiotics healthy and useful for both animals and humans.
Thank you for all your presentations. Dr. Rosie, you kind of explained how you're being the trust broker, trying to find a path forward, and the challenges. There's also challenges when people produce animals in different states or sell product in different states, and the lack of consistency and harmonization. How do you plan to express that for across the U.S., but even particularly on the San Francisco? Are you cooperating with them on their policy, and how do you think, will that suffice? Can you explain your plans there?
Sure. So I would say, as far as looking into the futures for sales and imports and exports in the state for meat products, that's it wouldn't surprise me if in the future legislation was put in place because that's what California tends to do, is start somewhere and then expand on it. Right now, we don't really have goals for restricting sale of product that was produced somewhere else. You know, we have feed yards and slaughter facilities that slaughter animals that were not raised in California. So, and that's something that we consider when we're doing our surveillance efforts. If we're looking at retail meats, it may not actually tell the story for what was raised in California, so that's something that we consider there. As far as the San Francisco ordinance, that was something that kind of came in from out of nowhere for us. We were informed about it about 2 days before they voted on it, and that ordinance is really based on collecting antimicrobial use information and doesn't really tie the consumer in anywhere. So I don't really know how. We wish that they would have collaborated with us on how to collect data or where it should be coming from and where it should be going, but they really didn't collaborate with us at any point. So in going forward with that, I'm not really sure how it will. I don't know that it will affect our efforts in collecting data. I think more it will affect the food supply in San Francisco. But I think how that's going to kind of flesh out as we go, as it becomes implemented, is something that I think we'll discover.
So, Dr. Siemens, with regard to the production of the antibiotic-free turkeys versus the conventionally raised, what is the difference in cost of production in terms of those antibiotic-free turkeys, presumably in reduced feed conversion and, reduced weight gain? And then the second part of the question is, in marketing those turkeys as a premium brand, what percentage increase is the consumer paying?
I love the questions, and I don't have the answers. There has been some production increase. We're seeing a couple different things that can get you directionally, right? There is a little bit of difference relative to feed efficiency. We're seeing some differences in mortality associated with it, and just along that lines. But as far as a quantification and the percentage differential, I don't have that. And then I haven't seen the price points going into the store, so go look at the Honest Turkey versus the other turkeys, and you'll be able to calculate that yourself relative to the differentials. But there is going to be there is a markup and a difference relative to the price point in the store, and it's going to vary depending on who we're working with, et cetera. So, but you'll be able to see that in the marketplace on that. So not much help today.
Hi, my question is for Ron. You brought up a lot of the public-private partnerships that have been moving forward. And my question is, I've seen a lot where we see from a consumer's perspective, and we've talked about the not doing a very good job of necessarily even informing the public of what have been traditional practices, how safe our food supplies are, and that in the past. How do we balance with the public-private partnership two different audiences? One, if the government's collecting the data, it can't be trusted. Two, if the producers or the industry is collecting the data, it can't be trusted because it's now biased. So I'm just curious from your perspective, particularly from communications and your background, like how do we help? Because I think the public-private partnership can be very powerful, but how do we try to merge that in order to really get messaging and talk to people as a whole that both brings the science as well as what's been traditional practices and what people are trying to do?
Well, first perhaps I could address how we achieve world peace. So I love questions. I love questions I don't have the answer to.
Yes.
It's curious because, take it as an example, we used to collect as an industry on a voluntary basis sales data. We would survey our member companies, and every year we would publish sales data. And of course, nobody paid any attention to that because that was industry data. So in 2008, Congress said, FDA is going to collect the data. And they're going to collect the very same data in almost the very same way, right? And publish it. And now suddenly the same data is like gospel. So you can take from that what you will, but I think that I hope that what we're seeing at USDA is going to be helpful, because what we have there is the combination of the two. We have private industry, the private sector, collecting data and feeding it into a public program, a publicly funded program, and hopefully, since everybody is involved in it, nobody can be trying to hide something, and the fact that everybody has a stake and say and an input will provide some credibility to that effort, and that's the best I can do.
Dr. Rosie, if I could, I want to go back to the question the gentleman over here asked and maybe follow up on that just a bit. because legislated or regulatory changes do sometimes spread to the east from the west of what happens out in California, and have caused changes in other areas as we look back over the last 10 to 15 years with animal care requirements. The original ballot proposal that was passed in California as it relates to cage sizes for hens and gestation stalls for sows did not require a marketing requirement in that change, but ultimately came back to it. And I think the question the gentleman asked is a very important one. What happens if it does, if the changes you've all done with antibiotics do lead to a marketing restriction in California? Have you all had discussions about the impact of food prices, what that means to Californians, and how that might impact livestock production and the requirements that potentially would spread across the country?
So my specific role is on developing the stewardship program. So those conversations may have happened with Dr. Jones. I'm not aware of them. We talk about it quite a bit as far as, you know, the effect that it may have on prices, and, you know, seeing that because it is a tendency with California that it may very well happen in the future. But on an official basis, I've not been a part of those conversations. I would say that, kind of going back to some of the conversations that have happened earlier, that our programs are, at this point, voluntary. When a government program says voluntary, it's usually perceived as law, and we're very aware of that. But I think, you know, as we've done a lot of outreach on what we're asking producers and veterinarians to do, the response is usually, oh, well, we're doing that. And we realize that. So I think it's hopefully will help with kind of the public outreach aspect. And we've been challenged by quite a few producers and veterinarians to approach public education on the issue. But I don't have a really good answer as far as what the conversations have been on that specific issue. Sorry.
Is there another question? Yes.
Okay. Dr. Siemens, in most of your species-based programs, I think all of them, the goal was slowing the spread of antimicrobial resistance, which is obviously a good goal. I was just wondering, is Cargill planning to actually get involved in the direct measurement of how successful that is, or are you going to leave that up to someone else? Or, and if you are going to get into it, what would you actually do? How would you measure it?
You saw my measure of success question at the end. Right, because, and it's my why as opposed to my goal, because the goal is several things that I can do to get to the why am I doing this. I really do think this is about slowing antibiotic resistance down. But other than the NARMs, you know, in the U.S., there's no real direct measurement. Well, and we have the, you know, deaths associated. We've seen that, right, on the human side. But in the animal chain sector, I don't know that we've pulled up, for me, I think, some really good baselines to know if we've made progress. How do we look at that across? I think there's some real biases in the NARMS data, knowing, you know, particularly retail samples today, because if anybody knows the ground beef supply chain, you know, I could have an animal growing in Louisiana, slaughtered in Kansas, and then parts ground in California and Maryland. And then you walk to, you know, you pick up the ground beef actually in Tennessee. So it doesn't tell us much about the geography. It doesn't really give us a total uniform representation of what's going on in the retail supply. SICA has its own issues. I mean, the NARMS meeting, lots of discussion about the differential between what they were finding in the SICA and even what they were finding in the products at the end. So I'm struggling a little bit with, really, for me, in seeing the animal agricultural endpoint of, is there antibiotic resistance, and is it improving? I'm not sure we've got a good metric today, and I'd love to, I've asked folks, we need to have a greater conversation. What does that look like? We've had some ideas, but I don't know how measurable they are and how uniform they are. So I think it's a great conversation piece because we don't have that piece of the impact that we've done and the changes we made in the animal sector. Where's that endpoint so that we can say we've been successful even if human doesn't move, right? Because there's a lot of things that occur in the human space, right, that may be independent of actions we've taken in the animal, and then throw environment in, right, you know, in the middle of it. So I think we need a better additional conversation about what is that metric of have we reduced antibiotic resistance, and how do we measure that so that we know that the animal industry's made progress or not, independent of, I think, the human side.
Okay, I think we've used our time here, and I want to thank the panelists again, and someone's going to wrap up today. Thank you.